Good day, kids. So today we're going to be investigating the plague, also known as Yersinia pestis. That's a bacteria. And this bacteria can come to manifest itself in many different forms. The first is bubonic plague, and that is something that we're going to try and find today.
Bubonic plague. Patients develop sudden onset of fever, headache, chills, and weakness in one or more swollen, tender, and painful lymph nodes called buboes. This form usually results from the bite of an infected flea. The bacteria multiply in the lymph node closest to where the bacteria entered the human body. If the patient is not treated with the appropriate antibiotics, the bacteria can spread to other parts of the body.
Let's go take a look. So the bacteria, Yersinia pestis, they multiply in the lymph nodes closest to the point of entry of the body. And that means that especially pets that aren't protected with insecticides like Frontline or other kinds of flea repellents, they are the most likely to have fleas that can carry the plague. And look what I found. Oh. A tennis ball. That means that likely someone with a dog was here in this very area. I don't think bubonic plague will be hard to find, mates. Oi, look over there! I think we found one! Oi, yeah, we did find one indeed. So, bubonic plague usually is defined by one or more buboes on the body next to the lymph nodes. And there's one right here, if you can zoom in real close and see this one. And then he's got another one down here near his arm. Now, let's see if he's awake.
Oh, man. Is this my house? It's so cold and... Oh.
Are you all right, son?
Grandma?
Oi, he must be so far gone. Should we get you to a hospital?
Oh, man. My stomach. Oh.
He's complaining about his stomach. That must mean that some of his buboes have ruptured and now he's on to septicemic plague. You can get septicemic plague right on, or you can get it as a result of the bubonic plague.
Patients develop fever, chills, extreme weakness, abdominal pain, shock, and possibly bleeding into the skin and other organs. Skin and other tissues may turn black and die, especially on fingers, toes, and the nose. Septicemic plague can occur as the first symptom of plague, or may develop from untreated bubonic plague. This form results from bites of infected fleas or from handling an infected animal.
I think we should get him to a hospital right away. Let's go. Oi, it's a darn shame that we couldn't make it to the hospital in time to save Pablo. It's important to remember that plague is incredibly infectious, which brings us to our next topic of plague, which is pneumonic plague. Oi, crikey, I think we found one. Let's take a look. Patients develop fever, headache, weakness, and a rapidly developing pneumonia with shortness of breath, chest pain, cough, and sometimes bloody or watery mucus. Pneumonic plague may develop from inhaling droplets or may develop from untreated bubonic or septicemic plague after the bacteria spread to the lungs. The pneumonia may cause respiratory failure and shock. Pneumonic plague is the most serious form of the disease and is the only form of plague that can be spread from person to person by infectious droplets. Crikey, yay, I believe we did find it indeed. Madam, are you well? Oh my, I should really not be this close to her face, but look at this mucus.
program to bring you some breaking news. We have just discovered that a swarm of rats were found dead in a batch of popcorn, and it has been discovered that they were infected with Y. pestis. This popcorn, since it is likely to contain their bodily fluids, subsequent infections. Yeah, okay. I'm having a stroke.
All suspected or confirmed plague cases and rodent die-offs in areas where plague is endemic should be reported immediately to public health officials so that exposure can be minimized to prevent additional transmission. Once plague is suspected, such as with our dear friend Stephen, appropriate precautions and treatment should be initiated immediately, and clinical specimens should be collected and tested as soon as possible. Early recognition of plague, especially the pneumonic form, is critical and to effective clinical management and timely public health response. In the future, help prevent the spread of plague with a rodent-proof living area, provide flea prevention for pets, use insect repellents, make sure you properly dispose of your garbage, and limit unsupervised pet outdoor access.
We now return to your regular programming.
Okay, so Mrs. Johnson, this must be Bear.
Yes, this is Bear.
Really? Okay, tell me about Bear.
Well, Bear is an indoor-outdoor kitty. He's on a strict vegan diet.
Really? Vegan? You know what? I'll just get to that later.
Okay. Well, the other day we let him out, and I think he must have gotten into something because he hasn't been eating. He's been vomiting, and I swear his head is twice as large as it was before we let him out.
Well, he's moving a lot, so that might make a... No, it definitely is larger than most cats. Weird.
Yeah, so can you help us, doctor? We just don't know what's wrong with Bear.
You know what? That's just strange. Did you notice anything weird happening with him recently when he was outside? Did you see anything?
Well, I think he might have gotten in a fight with our dog over a mouse or a rat or something like that. Yeah, I have the dog in the car if I should bring him in as well.
You know what? You should bring him in, definitely.
Okay.
What are his symptoms?
Oh, pretty similar. He hasn't been eating at all. He's definitely been vomiting. And, he feels really warm as well. More than normal.
Okay, so let me see. You know what? I'm afraid I don't know for certain, but it sounds like your animals have the plague.
I'm sorry, the plague.
Yes. I know it seems strange, but it actually is very common. Remember Yellowstone, like 2 years ago? Plague everywhere.
But this is an indoor kitty. I mean, he's only outside sometimes, so he can't have the plague.
I mean, I hope not.
Well, how can we figure out if he has it or not?
Well, we have to do some blood work.
Oh.
Yes, we're gonna have to do some culture, a blood culture, and check for polymerase chain reaction. We're going to do some lymph nodes as aspirations today, but we won't get results for a couple of weeks. While we're waiting for testing, effective therapies can include antibiotics, flea control. Is he on flea control?
No, doctor, that's why he's on the vegan diet. It's supposed to kill anything before it gets to him.
Effective therapies include antibiotics like doxycycline, flea control. Is he on flea control?
No, doctor, he only goes outside once in a while, and usually it's just to hunt rats.
Oh, okay then. Hospitalization.
The advent of antimicrobial therapy has reduced overall plague mortality from greater than 60% to approximately 16%.
Are you aware that plague is zoonotic?
I don't know what that means, doctor.
It means that it is transmissible between animals and people.
Are you saying that I have the plague? Do you think I have...
You know what, Miss Johnson? I believe that question is better left for your medical professional.